He has bad respiratory distress.
At a hospital in northern Rwanda, one of Dr. Alexandra Vinograd's newborn patients struggles to breathe. She needs an x-ray to pin down why.
So this baby's going to x-ray right now?
The very fact that there's an x-ray machine in this poverty-stricken area is remarkable. To the local people, it's even more remarkable that this hospital was built for them at all.
There was one doctor in this entire area. It was in a district of 400,000 people, and there was no hospital here.
Amid these farm fields, this new public hospital opened January 2011, and it's been turning heads and inspiring new ideas, even outside of Rwanda, as a model for new ways to bring health care to the poor.
When the hospital was first built, the local population did think it was a hotel. They couldn't believe that this was actually a hospital for patients. It's so beautiful that in addition to the medicines, I think people feel taken care of as well.
The Butero Hospital's unique design and approach were shaped by Paul Farmer's Partners in Health. The organization worked closely with the Rwandan government and the Clinton Foundation.
I'm sorry.
Partners in Health hired Dr. Vinograd on a 2-year contract.
I did my residency in Boston, and I've been here in Rwanda for the past year and a half.
As the only pediatric specialist in the entire region, the doctor sees almost daily cases where a child's life is on the line.
Jerion, what do you think?
The x-ray results of the newborn are in.
So
Dr.
the right
Vinograd
upper
reviews
lobe.
it with Dr. Jerion Najin, a Rwandan colleague.
So it looks like this baby has a pneumonia. I think the baby will respond to antibiotics. It just will need close observation. What I like to do is divide up the plan by problem. So what will we do for the pneumonia? We currently have 11 general practitioners working here. And with Partners in Health, they've brought in 5 specialist physicians working here. And our job is to accompany the local doctors, teach other physicians and nurses how to improve the quality of care that they provide and hopefully have some sustainable impact on the people here. Mama, baby.
Prior to the hospital's temporary clinic of 2008, mothers in need of emergency cesareans had no surgical rooms to turn to. Many mothers and newborns died. Now that's been dramatically changed.
In the NICU currently we have 6 neonates right now. 3 of them, I'm sure if this hospital had not been standing, would not have survived.
But the hospital is only the visible top of the system. The roots extend across the villages. Coletta Niyaramugera and Jean Bosco Nientaro Giroui are local community health workers. They are among the 2,500 health workers in this district alone that Partners in Health trained in a partnership with the health ministry. There are 2 in every village who work and live there. They make regular home visits to those with HIV or tuberculosis. They look out for expectant mothers at risk and for signs of malnourished children. Rwanda's grassroots approach has helped its surprising transformation from the tragic past of its 1994 genocide to current success stories.
I think Rwanda has done an amazing job with healthcare. I think they've really improved its health statistics over the past 5 to 10 years.
According to recent World Health Organization figures, Rwanda has cut the rate of killers like malaria and tuberculosis by more than 50%. Infant mortality has been slashed to less than half, maternal deaths reduced by over 75%. And the vast majority, 95% of 11 million Rwandans, have health care insurance under an inexpensive government plan.
To show you the pictures from before. Tade, makuru. Nimeza, sawa. He's a 14-year-old who was diagnosed with diabetic ketoacidosis. So he came in a coma, and he survived, and he looks great right now. But now he's a 14-year-old living with type 1 diabetes in rural Rwanda.
Cases like Sade usually call for a specialist, but in Rwanda, doctors are few and specialists rare.
I think I'm constantly challenged here. In the United States, I worked at Children's Hospital Boston, right next door to the Dana-Farber, next door to the Brigham. There was thousands of doctors in like 3 square blocks. Name any specialist and we would call them and they would come and see the patient. Here, there's 5 specialist physicians and 11 GPs trying to care for a district of 400,000 people. Okay. What do you want to do with the insulin?
And that leaves some cases simply beyond their limits.
Oh my gosh, what happened with this child? I'm a little worried about why he's missing his eye, but I guess we'll get there. Anita?
He's Samuel, 3 years old.
Oh, I know this kid. I heard about him by email. So he had a cancer of his eyeball, retinoblastoma.
Yeah.
That's a mass. So this is actually, there's metastases right there. That's a mass. That's the mass.
Do you know prognosis?
Death. He'll die. Hazarding an inexperienced guess, I would say a month or less. Oh, this makes me so sad. Hey, sweetheart. Amakuru. Samuel. Samuel. Hey.
Following a series of infant deaths in the past week, Samuel's situation hits especially hard.
It's seeing things that you know that if you had the right tools and the right people around you, you could do something different. And here, you do your best. Sometimes you know in your heart of hearts that there's nothing more you could do, but other times you wish you knew more.
But for each child who can't be saved, there are hundreds who have been.
Whoa, she looks so good. Sarah, mezaneza. Oh my gosh.
From Butaro, Rwanda, this is Ed Robbins for Time Video and the International Reporting Project.